Hi, let's talk about the root of the neck. In this video, we'll talk about the root of the neck, what it is, and which structures are associated with it, as well as any of the classic anatomical relationships among these structures. So let's begin simply with, what is the root of the neck? It's an important transitional area between the neck, the thorax, and the upper limbs. The root of the neck has many different structures that are comprising it. And it's important to think about the three-dimensional relationships among these structures. So one thing that we want to take note of here is that the clavicles have been cut right there, and it looks like right there, so that we can see the continuity between the elements of the superior mediastinum with the elements of the root of the neck. Now, the boundary between the root of the neck and the superior mediastinum is going to be the first rib. So the first rib really sets the division between the two. And that isn't something that we can see very well in this photograph, but in subsequent photographs we should be able to. So let's have a look and see what we are able to see. So this is a photo of the right root of the neck, and within the right root of the neck here we can see a cut first rib, and so I will highlight that boundary of the first rib as it's an intercostal space. I was confused, so it's heading that way and around that way. So anything below this first rib is going to be the superior mediastinum. The space that's prescribed by that first rib and the first thoracic vertebrae, the body of it, is known as the thoracic inlet. So that's where the viscera neurovasculature from the head and neck are continuous with the viscera neurovasculature of the thorax. One of the elements that is conspicuously missing here, that would be traveling along here, is the subclavian vein. We can see that subclavian vein is picked up here more laterally, but it's important to understand the relationships of these structures, because the subclavian vein is one of the anterior most elements that we can see at the root of the neck. And so very frequently in dissection, we'll have to reflect that away to see the deeper structures. One of the other very prominent and important structures is the anterior scalene muscle, which I'm outlining here. That anterior scalene muscle really is going to be the key to the root of the neck. It separates the subclavian vein from the subclavian artery. It also is going to establish the parts of the subclavian artery. So for instance, everything medial to it will be the first part. Anything behind it will be the second part, and then anything lateral to it will be the third part of the subclavian artery. We can also see just behind that anterior scalene muscle the roots of the brachial plexus. In this case, these roots are coming together for the superior trunk. We can see the middle and then the inferior trunk of the plexus below that. And then posterior to these roots of the brachial plexus, we have the middle and posterior scalene muscles. These scalene muscles are named because they look like scalene triangles. There's 3 pairs of them. When they work in concert as bilateral pairs, they're going to help to flex the neck or draw the chin towards the chest. If they work as, a right or a left set, they're going to ipsilaterally laterally flex the neck or the C-spine. These muscles attach to transverse processes of the cervical vertebrae, and they variably attach to these. And their inferior attachments are either going to be the first or the second rib. In the case of the anterior scalene, it inserts on the first rib, in between the subclavian vein and subclavian artery. The middle scalene is also going to insert on that first rib behind the subclavian artery. And the posterior scalene inserts on the second rib. Now, because these muscles go between the neck and the ribs, they have dual uses. So in addition to being able to variably flex the C-spine, if the neck is stationary, when these muscles contract, they can elevate the first and the second ribs. And when you elevate ribs, you increase the space of the thoracic cavity. And by increasing the space of the thoracic cavity, you're increasing its volume. And if you remember Boyle's law, pressure times volume equals a constant. Therefore, pressure is inversely proportional to volume. So as the volume of the thoracic cavity increases, the pressure decreases, and air can rush into the lungs. So these scalene muscles function as accessory muscles of respiration. So they help you to inhale. These muscles are served by branches of ventral primary rami of cervical nerves. So these VPRs would participate in both the cervical and brachial plexuses. So sometimes you'll see sources that relate the innervation of the scalenes to either the brachial plexus, which is the more commonly attributed plexus, or the cervical plexus. But the truth is that cervical spinal nerves from both plexuses innervate the scalene muscles. And these are served by the ascending cervical artery. Now, taking a close-up look at the first rib, we really see something special here. Now, bone is quite a malleable structure over the long term. So we see ridges based on where things attach to it. And so here, we can see this scalene tubercle of the first rib. So just so that we can understand, ribs attached to transverse processes and bodies of thoracic vertebra. So the vertebral body is going to be here. You'll see transverse processes out. So the head of the rib articulates with the body, the neck of the rib with the transverse process of the vertebrae. And this middle portion here is going to have some hyaline cartilage that goes out to attach to the sternum. Anyways, so here's our scalene tubercle, and that scalene tubercle is the attachment site for the anterior scalene muscle. Between the tubercle, and it takes a little bit of an eye to see this, but there are grooves here. There's a groove there, and there's a groove there. This anterior groove is for the subclavian vein. The posterior groove is for the subclavian artery. Now, it's not that these vessels exerted force upon the bone. It's just that the bone formed around these vessels, which we'll see. So now let's take a look at the spatial relationships of the neurovascular elements at the root of the neck. And it's kind of difficult to talk about these elements without also discussing some of the elements of the superior mediastinum, which, if you recall, is going to be everything below this level. So root of neck above, superior mediastinum below. So in other videos, we've already discussed the high-level overview of the veins, so this should go quickly. We have subclavian veins. Subclavian veins drain everything that subclavian arteries drain, namely the upper limb predominantly, as well as the head and neck and portions of the thorax. These are going to meet up with jugular veins. Jugular veins drain the head and neck of blood. And where these meet are the venous angles. The venous angles are the beginnings of the brachiocephalic veins. Right is short and more vertically oriented. Left is long and more obliquely oriented. And these brachiocephalic veins come together to form the superior vena cava, which then travels into the right atrium, delivering relatively deoxygenated blood back to the heart so that it can send it out to the lungs for oxygen. The veins are the most anterior elements that we're going to see either in the root of the neck or in the superior mediastinum. In fact, in order to see a lot of these deeper structures, we ask you generally to sever that left brachiocephalic vein so that we can reflect it out of the way to see the deeper structures. So let's take a look at some of the nerves as they traverse these spaces. The nerves are just a little deeper than the veins, but still generally more superficial than the arteries, as we'll see. Coming down, exiting the skull from the jugular foramina. Left and right. You're going to be sick of hearing what comes out of the jugular foramina, but that's where IJV starts, right? We also have the glossopharyngeal nerve, cranial nerve 9, the vagus nerve, cranial nerve 10, and the accessory nerve, cranial nerve 11. But coming down within the carotid sheath is the vagus nerve. We can see that traveling down there. We can also see the left vagus traveling down there. The vagus are going to be relatively medially located, but still think of them as strong carotid sheath contents. As they descend at the root of the neck, on the right side, the right vagus sends off the right recurrent laryngeal nerve, which is going to be more important in the larynx and pharynx session. That wraps around the subclavian artery and then travels in the tracheoesophageal groove up to serve the larynx. On the left side, look at this. This is really cool. The left vagus nerve descends down, and this is going anterior to the arch of the aorta, where it sends the right recurrent laryngeal nerve around the concavity of the aorta in the vicinity of the ligamentum arteriosum. The ligamentum arteriosum is a vestige of a vascular shortcut between the origin of the right pulmonary artery and the concavity of the aorta. In this case, it's just a nice anatomical landmark for where that left recurrent laryngeal nerve wraps around the concavity of the aorta before ascending up to serve the larynx. Those recurrent laryngeal nerves, as a teaser, are going to provide the motor innervation for all but one intrinsic laryngeal muscle, and they will be sensory and secretomotor to the mucosae of the larynx inferior to the vocal folds. Now, these vagus nerves send off a lot of branches. Vagus is a mixed somatic as well as a parasympathetic nerve, so it's going to serve motor functions in the soft palate and in the pharynx. It's going to be motor within the larynx. It's going to be sensory within the larynx. It's going to serve various elements of autonomic plexuses, such as the cardiac, the pulmonary, and the esophageal plexuses in the thorax with preganglionic parasympathetic fibers. It's also going to serve the foregut and the midgut with parasympathetic fibers, and those are going to originate from the esophageal trunks. And so those the vagus is quite a prolific innervator of the neck, the thorax, and even the abdomen. The other neurological structure here that we want to see is the phrenic nerve, but let's look at this on a different slide, so we don't have as much real estate taken up by the vagus. Let the phrenic have its time to shine. So the phrenic nerve is formed from branches of C3, C4, and C5. So the mnemonic is C3, 4, 5, keeps the diaphragm alive. So these go out, right, and form those nerves. So this is largely a cervical plexus. Cervical plexus nerve. And the phrenic nerve has a classic anatomical relationship with the anterior scalene muscle, and that is it just rides its anterior edge on down. So it's riding it on down. And this is a little bit of an error. It should go behind the first rib, but that's not too big of a problem. And on its way down, it's providing innervation, in part to the pericardium, but it's both sensory and especially motor to the diaphragm, which enables us to breathe. And then finally, the deeper elements of the root of the neck, so the ones that are the most posterior, are the arteries. These are all branches, ultimately, of the arch of the aorta, remembering that there is a brachiocephalic trunk that divides into a right common carotid artery and a right subclavian artery. The right common carotid artery is going to ascend in the carotid sheath, and then it's going to give out its terminal branches, the external carotid, which leaves the carotid sheath. The external carotid is going to serve the face, superficial head, and neck. The internal carotid artery is going to enter into the skull through the carotid canal of the temporal bone. And it's going to serve the contents of the cranial cavity as well as the orbit, the eye, and the forehead. The subclavian artery is going to serve predominantly the upper limb. It's also going to have branches which serve the neck as well as the brain and spinal cord, as we'll see. And also the thorax. So that does quite a bit for us. So there's this asymmetry with the brachiocephalic feeding into the right common carotid and right subclavian arteries. On the left side, the left common carotid artery arises directly from the arch of the aorta, and the left subclavian artery does as well, typically, I should say. Any of the branches of these right-sided vessels are typically also present on the left side, so the largest bit of asymmetry here with the arteries has to do with their branching pattern from the arch of the aorta here. So let's lead this into a question to test your understanding. While many of the anatomical structures of the root of the neck display strong bilateral symmetry, which feature has very typical bilateral asymmetry? Would it be the anterior scalene muscle, the phrenic nerve, the recurrent laryngeal nerve, the subclavian vein, or the vagus nerve? Well, let's think about this. The anterior scalene, we have one on each side, attaching transverse cervical processes of cervical vertebrae to scalene tubercles on the first rib. So that's not the right answer. In association with those anterior scalene muscles, we have right and left phrenic nerves, which descend from C3, 4, 5, from the root of the neck into the superior mediastinum on the way down to the diaphragm. That's not it. Recurrent laryngeal nerve, two separate origins. So if we recall on the right side, as vagus goes down, it sends recurrent laryngeal nerve around the right subclavian artery, whereas on the left side, it sends the recurrent laryngeal artery around the concavity of the arch of the aorta. Now, both of these recurrent laryngeal nerves are going to head for the tracheoesophageal grooves on the way up to serve the larynx. But as we can see here, there is a strong asymmetry. So that's a good candidate. Subclavian veins, they're both relatively bilaterally symmetrical. Vagus nerves, both relatively bilaterally symmetrical. So I think we have strong support for our recurrent laryngeal nerves being the most asymmetrical of the structures at the root of the neck. The other, which we can think of as a possible answer, would be the brachiocephalic trunk in terms of branches from the arch of the aorta. But thankfully, that wasn't an answer here. So, thank you for your time.